Hello. Dr. Neha, are you there? Dr. Neha? Hello. Neha, are you there?
Yeah, hello, Dr. Jitesh. I'm sorry, we had some technical issues. We were not able to get connected. So, uh, you can go. Yeah, we are live. Okay, we are on air. So, we'll start with the session. So, our topic for today is ABCD of homeopathy, that is individualization. So, I welcome all the doctors, homeopathic physicians all around the globe who have joined us for this webinar. I'm Dr. Neha from BHMS Group of Companies from Team RadarOpus. And today we have Dr. Jitesh Sharma with us, our guest speaker for today. So, Dr. Jitesh Sharma will be sharing his insights on the topic of homeopathy and individualization. So, whenever we talk about individualization, we all have a very bookish thing in our mind what individualization actually is. So Dr. Jitesh, in today's webinar, will give us insights about how to take this concept, individualization, into the practice. Yeah, sorry, we are back again. There is some technical issue on our internet on our side, so I really apologize for that. So, Dr. Jitesh, I welcome you to today's webinar. So, it is a pleasure of ours that you are here with us. Today, you will be sharing your insights on this topic of individualization.
Yeah, thank you so much, Neha. So, without wasting time, as we have very short time,
Yeah.
so I'll just start my presentation. Good morning, everyone. So, let me start the screen share. Let me know if everything is clear and
Yeah, everything is clear, Dr. Jitesh.
1 second.
We are live on YouTube as well. We got a heads up from our
Can
technical
you
team.
see? Can you see now?
Yeah, I can see your presentation. So you can move ahead with this.
So, good morning, everyone. Here's I'd like to introduce my team members, Dr. Rashmi, Dr. Lipsita. They have been part of JDS since long, and they have been well trained and well versed. And they will also share their experience, how it was beneficial for them to be here and learn and be a part of JDS. So today we're going to discuss ABCD of homeopathy. That means nothing actually. Very simple homeopathy. Very simple. All we need is to focus the patient that what patient demands, what patient is saying. So we need to see what is his complaints well, so that we can prescribe that remedy which matches his exact complaints. not to theorize, not to make inputs. So you need to see what is to be treated into the patient, what you're observing. On that basis only your prescription should be. It's not that you need to be very meticulous about it ki nahi, the if you have to prescribe on that basis, particular basis, on mind, on this physical, then this is nothing. You have to treat a patient as a whole, what actually wrong with the person is, and forget about the disease, forget about the pathology. Just focus on what patient is telling. That's it. So I would like to start with the first case. It was a case of severe sciatica, and it was an IPD case in a hospital. So let me start with the patient. On 29th March, this was the condition when the patient came to a hospital. Dr. Neha, just tell me if the video is clear and the sound as well.
Yeah.
Fine?
Yeah. Video is clear. Sound is also clear.
You can hear the sound, right?
Yes, I can hear the
Okay.
sound.
Okay.
Dr. Jitesh, the audio of the patient is not that clear. I'm not able to get what patient is trying to say.
Okay. So patient is saying that she's having a bursting pain on her leg, on her left leg. And she's in, yeah. Can you hear it?
Yeah, but I cannot figure out the language. Like I cannot
Okay,
figure
okay,
out what
that will
she
be clear.
said.
That will be clear. We'll explain the video after once it ends.
Yeah.
She's having excruciating pain. Even she's sensitive to the touch and pressure. So she's having pain while even in the pressure, even in the touch, she's complaining of pain. This is my team. They were trying to evaluate. You just observe. Everyone whoever is watching the video, just observe the patient's state. She's moaning in pain. So she's describing the pain coming from upward to downward, extending. So I would request Dr. Rashmi to explain what was actually happening on that day. Rashmi, please explain.
उस दिन ये एक्यूट पेन में आई थी 1 वीक से उसका पेन हो रहा था बट फिर 1 वीक से वो ट्रीटमेंट करवाए, एलोपैथी डॉक्टर के पास गए, पेन किलर लिए, बट कुछ भी आराम नहीं मिला। तो उस सुबह 9 बजे वो आए थे, उस वक्त जस्ट हम एंट्री किए थे। वो पेन इतना सिवियर था कि वो सिर्फ चिल्ला रही थी कि मुझे पेन हो रहा है, हो रहा है, और मूनिंग बहुत ज़्यादा था। फिर हम उसको उनके पास गए, क्या हो रहा है क्या नहीं समझने के लिए। वो इतना ये थे कि उसको हेल्प चाहिए था कि हाँ मेरा दर्द कम कर दो। वो सिर्फ चिल्ला रही थी कि मेरा दर्द है, दर्द है, दर्द है। और उस टाइम पे हम कुछ भी पूछ रहे थे और वो कुछ नहीं बोल रही थी, सिर्फ उसका बिहेवियर, और वो सिर्फ चिल्ला रही थी कि मुझे दर्द है। उसके बाद हमारे पास बहुत सारे रेमेडीज है, फिर हम इवैल्यूएट किए क्या नहीं।
वो क्या कर रही थी
बेसिकली वो सिर्फ दर्द में चिल्ला रही थी, और वो जब भी हम कोई भी मैं गई उनके पास तो वो पकड़ ली कि नहीं, हक कर ली, पास में रहो।
During the pain also, she desire or demand that someone come and hold her. In fact, she even cried holding Dr. Rashmi due to in this pain situation. In fact, she is in excruciating pain, and if you have watched the video, she demanded someone to come and hold her. Even in the pain, she wants to hold someone's hand, and she wants to just pacify herself that someone is there for her. So this was a case history. Last 9 days, severe pain arises left side. She was taken to a hospital nearby. She took the injection. Then she went on to nearby nursing doctor, and she was referred to the neurologist, but still she didn't got any relief, and even then one of her relative advised her to take homeopathy. So then she came over here. So let me start with the chief complaints. She had sciatica pain, left-sided, aggravation by touch, talking, drawing of limbs, restless in bed, slight movement aggravation, pain sudden rises, nerves bursting like pain. She lying cannot able to sit, pain better by heart pressure, rubbing, popping toes, not desire to talk because of pain aggravates, restless body, moaning with pain, weeping with pain, needs sunlight. She does, and she, as you have seen the video, she was not liking the cover of the curtain, and burning in leg, which was better by cold, and fanning desire. Past history: left kidney stone size, appendix gallbladder removed. She had a UTI, COVID positive also, and family history: 3 children, and her elder son is handicapped. Physical gender desires salty, sweet, pickle of mango, thirst, thirstlessness, aversion, fruits. Mind, desire company, never remain in dark, always need light, weeping during pain, and she's very emotional and sensitive. So this was very short, and only this inputs we could have figured out during the case taking. Thermal, she was hot. So anyone with the medicine, if I can see the screen, chat. Anyone wants to suggest the medicine?
Dr. Jitesh, you can keep your PPT open. If there are any suggestions from our viewer, I'll
Yeah,
let.
please. Yeah, anyone want to work out and let me know, because we should be interactive.
So if any of our viewers have any inputs, what medicine it can be, you can write it in the comment box. Or if you have any doubts, any questions, any more questions to ask to Dr. Jitesh regarding the case, you can write down.
Yeah, surely, surely. Let us work out together. No, that will be very helpful. That is what learning is to be.
Um, I guess, Dr. Jitesh, we should move on with it. With the
Okay.
yeah.
So this was the repertory done. Sleeping with pains, sciatica pain, thirstness, Stramonium, aconite, amon, mur, belladonna, arsenic, calica, phosphorus, pulsatilla, staph. So these are all the remedies which came indicated. Well, the remedy is
So
pulsatilla.
we got one suggestion on YouTube by Dr. Neha. She also said pulsatilla.
Very nice, very nice. So I gave it LM1, and when we started LM1, I think on the first cup, how many doses of LM1 she felt better?
4 doses.
After 4 doses of LM1 in the first cup, she felt absolutely better. After that, we gradually increased to second cup, third cup, and I'll show you the video on that next day, on next particular day. Can you see the video, Dr. Neha, if
Yeah,
everything is clear?
yeah, everything is clear.
Yes. So you can see the effect of Pulsatilla LM1 on the very next day. Dr. Neha, any questions?
There are one question is there regarding how LM potency. Like, can you please throw a light on LM potency? Like, why and why did you selected that, and how did you give it to the patient?
Uh, it's a whole, actually, LM potencies, the dispensing method is very simple actually. When you get Pulsatilla LM, you need to take only one pill and give it on the 100 ml bottle, and fill the bottle with the water and give 10 strokes, 10 downward strokes, and you have to dispense it like one cap on a half glass of water, and one cap of the solution has to be mixed in the one glass of water. You have to stir it down, and the patient has to sip it, and sip it like only 2 sip is enough, and rest all solution has to discard, and every 5 minutes the same procedure has to be repeated. So it has to be done like first we gave on the 4 times, then we gradually increase, then half an hourly, then 1 hourly, then 2 hourly, then 3. Depends upon the patient intensity of symptoms. So this was started by LM1, and next on the discharge day, the day of discharge on 1st April. So how only Pulsatilla was used, and that too from LM1 on the day of discharge. I think we shifted to LM2,
Okay.
and after that, this was the response. So coming to the next case, case of retention of urine. So everyone listen the complaints of this lady, what she's saying.
Dr. Jitesh, audio is not. It is not audible. Still not audible.
So I'll let you tell. I'll tell you what she's telling. She's telling that she's not at all satisfied after the urination, and she feels that there is a urge of constant doing constant. There is a constant urge for urination. She has that urge very, very high, but the urine is very scanty. And she always feel that some part of the urination is left behind the bladder. So there is always sensation that there is something left, and she's not at all satisfied by doing the complete. She doesn't have that feeling of complete evacuation, and even she has that sensation of bloating on the abdomen as well. And she was suggested operation by a allopath practitioner. So she was suggested that she might have same issues after the operation as well. So she tried to avoid it and she wanted to do homeopathy regarding this issue. So let me start the complaint. Chief complaints, she's 32 years female. She came on 4th April. She has a difficulty in pass urine since December 2021. She was already taken allopathy, and already there was a test of post-void residual test that was positive, and she was on medication. Then she discontinued again. The pain relapsed, and there was a swelling as well on the arm, face, and foot, even thigh, abdomen, in the heaviness. So doctor asked her to do the operation, but she didn't wanted to do it because she was suggested homeopathy by some of her relatives. So history of 2014, she was suffering UTI and she took treatment. After that, she got this first bloating, and even after taking the water, she was not able to urinate well, and she had that habit of holding the urine prolonged. She always tried to control if the even during the urge, she does not go to urinate. She had that habit. So now when she came on present day, there was retention of urine since 7 days. Half of the urine remained in the bladder after urination. Urine morning frequently, half an hour interval, and even the night there was 3 to 4 times. She used to feel the heat during urination, not burning, no itching, no pain. Color yellow. Last 15 days back, she feel hot, but also she had such chills in the body, no sweat. She was feeling feverish. She wanted thick covering. She took paracetamol and she felt a bit better. Heaviness feeling when swelling was only at leg, foot, hand, abdomen, face. Pain is also there, and she's always frustrated due to workload and children and their day-to-day activities. So past history: childhood chickenpox. She had a history of fracture, typhoid 4 to 5 times, to normal delivery. She has taken 2 times for abortion. There were, and there was also a history of scorpion bite. Family history: father was 1 year old. When she was 1 year old, her father died. Mother death is by 2012. She was actually trying to save her mother. Actually, sorry, her mother was trying to save her. In, uh, she was saving her because she got electric shock. The patient himself. So her mother tried to save her, and she died at that way. Her mother got unconscious and she died on the same day due to the electric shock. So all time, her family, her brother, her sister-in-law, everyone tortures her that because of her mother died. So she had that feeling that everyone just torture me and tell to me that I am the culprit and because of me my mother died. So diet, she used to have non-veg, only chicken. Desire salty. She loves gupchup, pani puri, green chili, extra salt. She doesn't like sweet much. Uh, she had that tingling sensation on the head, and she had that she remembers a lot of past events, and she took the depression treatment as well because of this state, because she was being tortured with her relatives and everyone because of her mother died. She had caries in her teeth, thirsty, but doctor advised to take less water just because of retention issues. Tongue moist. Menses were quite normal. Leukorrhea when she like any she says that when there is a delay in taking food or white discharge, after also leukorrhea after like menses also it remains for 7 days. Sticky, skin crack, and dream she saw the same incident again and again, the electric current incident, whatever happened. So now sexual life, as her husband has a more age difference with her, so there's a lot of fighting, and usually she goes to parenthood, and there is a lot of arguments, and the understanding doesn't match. Childhood, parents' death, as a father died early, and the mother was also died in an electric shock incident. Brothers take care her, and but they torture a lot mentally, so she doesn't have a good relationship with the siblings. So not talking with the big brother, and I'll cut it short. Actually, she her husband also doesn't support her, and she feels that she told me that whenever she gets insult, she would cry whole day, like whole day. Whenever say anything happens in the house, and if she's blamed for that, she's weeping all day, and that incident doesn't go out of her mind. So she's very, very emotional. She always thinks of the past. She loves consolation, cleanliness, mother death. Always like she has that always everyone is blaming me because my mother death. I keep on thinking about it, and my anxiety. She has a lot of anxiety about health, and she wanted to study more. Habit of so ailments from habit of UTI, a habit of so there was a history of UTI. Sorry, and she had a habit of holding urine prolonged. Thermally, she's chilly. So, any guesses with the remedy? This was the case.
Yeah. You can write down your suggestions of what remedy it should be in the comment box. What remedy should it be? Very interesting case it is. Staphylococcus aureus, one of the suggestion is Staphylococcus aureus.
Very nice.
Ignatia.
Very good.
Lycopodium by Dr. Dilip. Dr. Nitish is saying Ignatia. Dr. Bharti, Staphylococcus aureus.
So, two staff, one lyco, and
Causticum is also there. Dr. Siraj.
very nice. Very nice.
Ignatia, 2-3 people are going for Ignatia. Dr.
Very
J.P.
nice.
Montreal is saying Natrum muraticum,
Natrum
pulsatilla. So these are the few recommendations that we got, amongst which Natrum mur, Lycopodium, Staphylococcus aureus, Ignatia, Lac caninum are there.
Okay.
Causticum as well.
Very nice. So, I'm very happy. Like people have actually reached to the right point. So, this is a repertory chart. So, Dr. Neha, how many people with staff, and how many people with lyco, and how many people with natrum mur and causticum?
Okay, so like there are 2 people with Lycopodium,
Mm-hmm.
3 on one with Natrum mur, 2-3 people with pulsatilla, and like 2 people with Staphylococcus aureus.
So, congratulations. The remedy is staff. So, the people who wrote Staphylococcus aureus, they are correct. And the people who reached to causticum as well, they are also correct. So, there is a subtle difference between causticum and staph. And that has to be read, and that is causticum. You'll see there is a lot of injustice. They cannot tolerate. They can revert back. They can revolt for it. But staff will never revolt. She will keep everything inside, and she keep on wearing. Oh, mere ko aisa bol diye. Oh. That blame is that is staff. She'll keep inside, and she'll keep thinking about it. the injustice, the unblame, accusation, everything that is staph. Causticum will always retaliate.
Yeah.
And Natramur was out of question because uh, Natramur will either sulk more deep or she wouldn't reveal so much. First of all, Natramur बोल ही नहीं पाएगा इतना. The amount of enormous information which was given by her, Natramur would have never said so much. And definitely there should be aggravation from lot of heat and everything, which is a keynote of Natramur. So that was not found in this case. This was everything. This was that the suffering what she went through. And after staph, see the follow up. Tell me if you're loud and clear.
Voice is not audible, so I cannot hear that.
Okay. So she's selling since 3 to 4 months, and this was follow up on 25th April as well. This was like a few days back only. So it was a staph for 30 was given like BD, and I gave in water dose. So I gave staphysic area 30 BD on water dose, and after 20 like few days in 24th April, she's explaining. She's feeling 55% better after the medicine, and all her bloating, heaviness, everything was better. You can see the expression, because see what I want to say and I want to share with everyone, that if you give a correct remedy, you can actually see the patient's face, how lively they become. So that is the power of individualization.
So, Dr. Jitesh, we have a question from one of our viewer, which is like, why not ignitia? So, how did you rule out ignitia from the picture?
Okay, very interesting. Whoever has put question, ignitia will be more of sort of reserve, like they have the grief inside and they will suffer. They have the suffering has to be seen on the face. If you see the video, Ignitia will never speak like this, that I'm having these all issues. See the face of the video. This is not Ignitia. See, today's webinar, to be very honest, it's very short to explain, like observation, how to see the patient's face and decide, and what's her how to like correlate with the symptoms on the face and the expressions, because that is entirely based on one-to-one individual experience and observation. So this is not Ignitia will never be so lively, and she'll never able to express so much. There is lot of Ignitia people, if you ask question, she'll be very much quiet. uh, she won't speak much. Ignitia people doesn't speak much. So you have to decide on what you see, not on not on like other things. You have to be entirely focused on patient's face, what she is or he is trying to explain, what she is saying. And Ignitia could be very close, but she's not at all Ignitia. Ignitia doesn't take like all the blames and everything, and she not keep brooding about the blames what she's going through. I hope I'm clear.
Yeah, yes, Dr. Jitesh. We can move forward with the next case.
Yeah, sure. This is a case of oral neoplasm. So how homeopathy can help in these type of cases, I'll explain. So anamnesis in 2017-2018, the patient feel growth in the mouth, and then they consult to a doctor and they did not find any result. And he used to take like mushroom powder in the gym, and he had root RCT in 2017. So this is his face, and you can see the growth. If it's visible, can you can everyone see that?
Yes, it is visible.
Yes. So chief complaints is the case of oral neoplasm, difficulty in breathing by left nostril, Left nostril always blocked. He has a feverish flame, pricking pain, pulling pain, hardness in outer area, but in internal area, mild hardness. Aggravates in AC room when working in system that is computer, and in morning in winter season better by hot application. So past history: root canal treatment 2017, typhoid 17 years old age, malaria 10 years back, right renal stone, cold vaccine done, mild fever 2 or 3 months back. Family history: father suffering from sleepless issues, mother gout complaint, grandfather expired by COVID, maternal grandfather TB, paternal uncle suffering from diabetes and hypertension. So physical generals: he likes more of chili foods, pickles, potatoes, spicy food. Digestion issues is he doesn't have any digestion issues. He has lot of he's very less thirsty. He has that eczema on the nape of neck as well. Sweating, very moderate sweat, and sleep. He sometimes snore, sometimes mouth is open, and even the saliva comes out during sleep. So this was the case. Occupation: he's a deputy manager in the bank. Childhood, his childhood history, like he was very short temper in the childhood, a very shy nature, fear of ghost, and when he described about his nature, he gets very panic when he listens to cancer. He has that suicidal tendency when listening to cancer related to things. He cannot tolerate that word cancer. Like traveling, time spent with family, irritation to the present disease related, and a friends also not giving support when he's suffering from cancer, so he feels bad about it. So he usually suffering from this issue from like quite a long period. I believe he was suffering from 2017, and he came us to on March 2022. So at present complaints like major setback ailments from that present complaint is to related is suffering from stress related to whatever happened and the disease converted into cancer. And present he feels a lot of like issue regarding his disease itself, that why I'm suffering from this. Thermally is chilly. So this is the case. That's it. Any suggestions with their medicine?
Yeah. Our viewers can write whatever medicine they think should go for this case. And meanwhile, Dr. Jitesh, till our viewers are answering, giving their suggestion, there was a question regarding your first case. Why did you opted for LM potency? Why not to go with other potencies? Why to select LM?
See, off late, what I have been experienced, like it's been 12 years of my practice, and what I have been experiencing that what result I'm getting in LM potency, I'm not able to get in centesimal scales. And once you start LM potency, the improvement is very quick compared to centesimal scale. What I have been seeing. So I opted to LM potency, and usually in IPD cases and in all severe gross chronic cases or pathological cases, we generally start with LM. That what it's totally our experience and our build-up, because we have found LM potencies to be more efficient than centesimal in these type of cases.
Yeah.
And this is my version, but I would really advise or suggest you try yourself and you find out the results.
Yeah.
I think then only you will get also convinced, because it comes up with a practice, totally entire about practice. And even in this case, whatever the oral neoplasm case was also I used LM. So I'll see the effect. You can see the effect how fast in these very deep cross cases, how you can get quick results and how the patient is relieved soon.
So, Dr. Jitesh, we have like two suggestions. One is carcinosin, other is equinite, based on mental symptom, which is fear. Very predominant fear is there. So that's why.
First is carcinosin, very nice, very nice, and second is econite.
Yeah. So,
So if anyone, like everyone can see the repertory chart. Aurum, sepia, phosphorus, equosol, pulsatilla.
arsenicum is also there, which have been suggested by Dr. Irana.
Okay, very nice, very nice. So let me tell you, this is aurum melambus.
Saphysagria due to indignation. Arsenic album medurinum. Okay, few suggestions.
So the prescription is Oromet 0/1, that is LM1, and it was given BD on the first cup. And see his version after like 20 days itself. Can you hear?
No, the audio is not clear.
So he's saying that I had that lot of burning inside in the starting of the medicine. I didn't find that the doses actually he was taking very less. It was persisting. Then after that, he was starting taking the medicine again. He started the improvement on the. He feel the improvement on the very same day. The swelling and the hardness, he feels that it's been better. From earlier, how he's feeling, he said that 50% I'm better. From the starting of the medicine, didn't feel any change. It took some time, but he can see the effect after few days itself. So he was instructed to reduce his doses once he find the improvement. So this is a fresh video. We asked how's the pain. He said that I'm 80% better after on 18th March. Okay, we are running a short of time. It's 11:42 already. So after he's still on Aurum Med, but now he's taking 0/2.
Okay.
Because he is better, but yet he has some few complaints. So usually when the patient is better and still complaining of few complaints, we usually have to change the potency or scale of the same medicine, not the change the medicine. When the patient is better on that particular medicine, we should continue with the same medicine unless any new picture comes up. So case 4, there's a Steven Johnson syndrome, keratitis. This is a very difficult case actually what I have encountered. SJS. So in SJS, actually, uh, this was not a picture of complete SJS, like a lot of big patches and everything in the skin disease and everything. In this particular case, there was only more of ocular issues, not the skin issues. But generally, in the SJS, they have a lot of skin issues as well. But in this particular case, there was only on ocular issues, with conjunctivitis and scarring and everything, inflammation. There was, you know, there was like blurriness on the vision, and there's a lot of things. So, age 26 female, she had a viral infection and she took I'll be little fast. She took the medicine and she was not feeling better. Then she went been to ophthalmologist and there she went. He was not able to diagnose. Then they went to someone and then they said that okay, this is SGS. They confirmed from the test and everything. So she was complaining like, all issues were only in the eye. That's it. So eye are dry, difficult to open, sensitive to light. Also, there was a lot of dryness in the eyes, and even she was suffering from jaundice as well. And in the there was itching in the body without eruption. Past history, she got TB, COVID positive. She also had a oral aphthous, cervical lymphadenopathy, PCOD, malaria. She desires a lot of sour and salty food, and she doesn't like bitter food. She's thirstless. She had a history of mouth ulcer due to medication, all the allopathic medication she used to take. So let me tell you how we fail and how we treat. So, or her life space, like she has a lot of fear of heights, fear of darkness, fear of depth of water. She loves animals. She wants a dog, but family doesn't allow. She avoids negative people. Hopeful for recovery. Like she's not so organized, but okay. She's a very independent. She's a jewelry designer. She wants to pursue her career. So these all were the inputs which we got. Thermally, she's hot. This was the case. So any suggestions with the medicine?
Any suggestions our viewers have regarding this case? Dr. Jitesh, regarding your previous case, there was a question
Yes.
regarding repetition of LM potency. You prescribed that patient aurum metallicum.
Yeah,
Uh,
BD. It's all BD.
okay.
Twice a day. Because generally in deep pathological cases, we use give BD so that we can see the improvement day by day or within 10 days, or we keep a follow up, or like after 2 weeks how you're feeling. So it was all BD, and still he's taking Oromet 0.2 BD.
Okay. And so there is one more question.
Yes.
It is on YouTube. So do you think LM potency is safer than other potency for beginners?
Definitely, if you want to see that how homeopathy works fast, you can just use LM potencies. See, that doesn't imply that centesimal is not so fast. It depends upon the case to case and their vitality. So posology is yet another big topic we needs to discussed well. Then only you can see that in which cases you can use LM and in which cases you can use CM. Even it is not compulsion that even if you give centesimal scale and you have to continue on centesimal scale, you can see the effect of centesimal scale, then you can shift back to the LM as well. There is no hardened rules. You can use accordingly.
So Dr. Jitesh, few suggestions are argentum nitricum, nitric acid, sulfur, phosphorus, gelcemium.
Very nice. I'm very happy with the suggestions because the people are actually reaching to the right remedy. But let me share my experience that how drastically I also failed. So this was the reputation chart, and the medicine which I gave, that was pulse 0 by 1. Okay, and she's not better. I done a same, and she got operated for her keratitis, and she was placed inside a membrane. And after that, again she came back to me, and again I took the totality, and I gave natrium 0 by 1, and again I failed. So after 10 months, she came again by same complaint. She's still on. There's a lot of dryness and everything, and there was like pure. I'll show the photo. This was the condition. As you can see,
Yeah.
so she had a lot of pricking inside, eye edges, burning, swelling, itching. Even she started using lenses, and she has discomfort with the lenses. And she used in 24 hours. She used to use 10 ml of eye drops. Even she was on steroids. She had a left lesion blood and blurry vision after operation. And even that semi-liquid discharge, you can see that discharge. You can see the purulent discharge. I think everyone can see the purulent discharge of the eyes, right?
Yeah.
So I gave, as everyone suggested, argentum nitricum 0 by 1, and I failed again. So again, profuse discharge after 24 hours itself. I gave there was profuse discharge in 5 to 10 minutes. The vision was becoming blur. After argent nitricum 0 by 1, she complains that same, the eyes swelling, eyes paining a lot. I gave phosphorus, and I failed. So after 48 hours, I worked out. There was profuse discharge and the same complaints, and I prescribed Euphasia. So now, why Euphasia? If you read Allen's keynote, there was profuse acrid lacrimation with profuse blind coryza, reverse of all. You can see the second line. The eye waters all the time and are agglutinated in the morning. The margins of lid are red, swollen pus. So now, very interesting things. What Allen's keynote made me to uh, realize that why Euphasia should have been given on the earlier case on the very first day. See the relationship that is similar to pulse in affection of eyes. So the reason I shared this case, the only thing is that how we fail and how we learn and how we treat. So I'm not the one that in one click I can treat everyone and I'll get results very SOS basis. So I also fail, and why I fail, I work out how to correct my mistake or where I was wrong, where I didn't use, why didn't I use. So this is the next slide. After treatment, you can see, I think everyone can see that. On 4th April, you can see the chat. After 20 minutes itself, I asked her to take and how she's feeling. And after 4 times in time, on the very next day, I asked, how are you? And she said, much better. And this was the condition. So only in one day. So that was the power of, you can say the right remedy. That was Euphasia. So, any questions?
It was, I guess, regarding the previous question only, previous case only. You prescribed LM potency for how many days, as it is followed by SL usually. So, for how long you should prescribe it in?
No, I until and unless the patient feels better, he's taking the medicine. It's not like on SL basis, because the patient is still better, he's improving. So I just change up the scale, because as we are treating a case of very gross pathological cases, so I don't stop the medicine right away until and unless patient says that he's 100% better. When the patient says he's 100% better, put on SL or put on give nothing or stop the treatment. That's it.
Okay.
So he's still better, but still has the complaint. So he needs that medicine on the regular basis. It's not like wait and watch theory. Give one and wait for 1 month and see whether you get result or not. We cannot live on this. Like today's generation cannot live.
Yeah.
Everyone wants results on the table, and be a result-oriented homeopath, not only blabbering about it. When the patient is in front of you, he wants treatment and he needs results on the spot. So do hard work, make yourself so much eligible that you can prove your worth by giving a right remedy to a patient. I'm not saying that you will be selecting the first remedy itself, but at least have the courage to make the patient sit in front of you and give the medicine and ask him whether he's feeling better or not. Have that courage. Don't be a homeopath by saying that, okay, you take this medicine, you take away home, and you let me know in 1 week, or let me know in 2 weeks, or let me know after 1 month how you're feeling. At least, see, there's no harm, but at least be sure enough that yes, that medicine is working him or not, so that you can choose the right remedy on the spot itself, whether it's helping him or not. And especially in this phrase, I'm saying it, especially in acute conditions, because they has to be treated immediately. Otherwise, they'll end up going somewhere else, and they'll believe, yes, homeopathy to kaam nahi karta, boss. So this attitude has to be changed, and this can be done by our people, ourselves. By hosting this webinar, I'm not saying that everything can be learned in a way. It is more of practicality. It's more of clinical training. These people have been here for 2 years now. These have been learning. They have been seeing. They have been witnessing themselves. It's not about reading online everything and attending courses, and you'll be very much a lot of theorizing and reading books won't help you over here. It's all about critical observation, and it's more of clinical training and what has to be done on the spot.
Very well said, Dr. Jitesh. So, one more question regarding this case.
Yes.
So, why did you go for 30 potency? Why not LM?
Because I didn't had it. I didn't had Euphasia LM. I had 30. I used it. I got result. Because LM potency, I didn't had the all scales. I didn't have Euphasia, so I used 30 scale.
So there is one question: can we give Euphasia only if any patient have only complaint of watering eyes all
No,
the time, and there
no,
is no other complaint?
no. More of Euphasia is more of a personality like pulsatilla. So if he gets a person of more of pulsatilla, and yet he has lot of affinity on the eye, he should give Euphasia. That's what my point is.
Okay.
The only reason I shared that slide or shared this case, just to make aware that how we fail. She was a pulsatilla picture, but yet I failed drastically by giving pulsatilla and gave Euphasia. I got result on the very next day. That's what my message is.
Yeah.
Okay. So coming up to the last case, last and final, as we are running short of time, that is trigeminal neuralgia. Male 69, trigeminal neuralgia since 4 years. He took a lot of homeopathic medicines, hydrocodone, arnica, ilium cepa, hypericum, and he was also feeling better after arnica 200. So he had myasthenia gravis as well in 2010. He took treatment. He feels better now. Now since 4 years, he has been diagnosed with trigeminal neuralgia. He has a lot of domestic stress since childhood. After his grandmother's death, his stress increased. He doesn't have a good relation with his father. His father doesn't listen to him. He had a lot of dominations, and his father gave a lot of priority to his brothers, and he was the eldest one among his all brothers. So 4 years ago, he said he felt like current like sensation as a 440 volt in left upper jaw at his premolar teeth. And after that, he was treated with a dentist, and that dentist extracted his tooth, but that current like pain always remained. And he was consulted with a neurologist and said that he's suffering from trigeminal neuralgia. Left side, since 4 years, onset sudden severe, and the pain comes and go, and it's very sharp and severe. And there's a current pain as if electric like. Now he feels difficulty in chewing food, even watery eyes while eating because of due to pain. There are a lot of current like sensation in the left upper jaw, then radiate whole side of face, more of sensation at the tip of nose, upper lip swelling, left sided lower jaw. Even he took the laser treatment as well, but still he has that current sensation, chewing aggravation, lying down aggravation, lying on the right side aggravation, drinking aggravation, eating aggravation, even due to pain. He always used to put his hand on the face due to pain. So he had myasthenia gravis, and he had a malaria and mother history, like family history only, mother suffering from osteoarthritis. He had a habit of pan, which he quitted like 5 years back. Veg diet. Even he doesn't even he had a lot of desire of like pani puri, sour. He's fond of very much sour food. Even he had a cataract, thirst test, hard stool. Is due to allopathic medicine he used to take, and urination is very clear, but sometimes there is a burning and frequent urination 3 to 4 times, trembling of both hands as well, and sweat is moderate. His nose and dreams not something peculiar. He just distributed some rice in dreams. Mind. So this is now interesting part. Childhood was good. My grandparents loved me a lot. When I was 6 months old, I was with him. He was very smiling by saying this childhood history. So he doesn't have a good relation with his father. His father gave importance to his older brothers. So after marriage, he did a love marriage and he's happy about it, but doesn't have a good relation with his brothers. And they always blame that he had an affair with his cousin, and his wife always influenced with it. So this is where he cannot uh, tolerate that that he was blamed that he had a affair with his cousin, and my wife influenced with it, and now my wife doesn't believe on me, but I love her a lot. I cannot bear this suffering. He had some issues with her wife as well. So now he has that tendency that he's asking for help, he's begging for recovery. He had a lot of fear of operation and injection. Even he cannot see whoever takes the injection, he cannot see, because that of fear he does avoid to visit a doctor. And that is the only reason he used to watch YouTube, and he used to take all the trigeminal all stalwarts whoever in YouTube are saying that this medicine works in trigeminal neuralgia and this and this. Many people, Dr. Neha, how it goes now, YouTube theories and YouTube teaching everything, that you take this medicine, you'll be all right. So he used to do the same. So he has a lot of faith in homeopathy. He used to send a lot of patients in this hospital, but he never came himself for a treatment. He has a lot of domestic stress. His domestic relationship was very much strongly affected. If anyone shouts at him, he gets quiet because he thinks there's pointless to quarrel with others. He doesn't want to quarrel with anyone. He used to stay quiet. If any person comes and just says anything to him. He loves to travel. And now the interesting part. He says, I feel better when I am away from my family member. When anyone talk nicely to me, I can do anything for them. He's very emotional. He cannot bear others' sorrow. Any incident. I felt sad about my daughter. She married twice, but unfortunately her husband was drunkard. He used to beat her, torture her. and her husband also expired. Now her daughter stays with her, feels very sorrow because of her daughter's fate. He was really very, very religious before his illness, but now he doesn't trust God anymore. He cannot bear the foul smell. He cannot sit on that area. He likes cleanliness. When he see any dirt, he cannot eat food. He's a lot of fastidious nature. He's a restlessness. He's very restless, and he cannot see any incident. I cannot bear it. I close. I want to leave that place as soon as possible. And his son doesn't listen to him at all. So this is a case. I think everyone has come up with the remedy. I feel thermal is chilly. So Dr. Neha, you can see the suggestions.
Yeah, please share your suggestions about this drug. So regarding the previous case, we have a couple of questions. So till the time people are giving their suggestions,
Yes, please.
I'll ask the question. So Euphasia was given. So what about the constitutional medicine? The other question is also very similar. So after Euphasia, should we give constitutional remedy, pulsatilla?
If the picture clear up, because she is still on Euphasia and still better. Not on the regular basis, on the SOS basis.
Okay.
If that's what I'm telling, if the picture comes up, then definitely. You have to focus on present, prominent, and persistent symptoms. So, any suggestion with this remedy?
So, any of our viewers have any suggestions on YouTube? Do we have? Not yet. So,
This is the last case, and so there's no suggestion yet.
there's no suggestion yet. So we can. One is Pygelia.
Very nice. I gave Spigelia. I didn't find relief on the spot. Now,
Carcinosin MAC group of remedies.
MAC group. Okay. Did he said that he had that all of forsaken feelings and he doesn't like milk, because magnesium people doesn't like milk.
One more recommendation: arsenic album, phosphorus.
Excellent.
Aurum
Phosphorus. Yes, aurum met. Very
Lachesis.
nice.
Lachesis.
Lachesis. Okay. Lachesis. Okay. So what I'll do, I'm showing the video of the patient that what he's saying. He cannot even walk. He can feel the pain, and you can see his mouth. Everyone can focus his mouth. If it's okay if you're not able to listen the video, but see his mouth and his face expressions, you can figure out how much pain he is. He cannot even open his mouth. He's saying it's like like electric current. He's having that pain. So after treatment, see that was he's saying. The day he gets stressed or any family dispute starts, his pain starts coming up. See his expression. He's saying that when I came, I was not able to speak as well. And after taking the medicine, he's feeling much better. So this is the repertory chart. I gave staphystic area. Zero by 1. It's still on staph. So Dr. Neha, I think there will be a question.
Yeah. If any of our viewers have any question, you can write it. Dr. Jitesh will be happy to answer all your questions.
And even they can mail me, as I'm running short of time now. But let me tell you why I use staph, because this is aphorism 5 actually. So the relationship, the domestic relation, due to all the domestic relationship and whatever happened in his life, that has affected a lot. Plus, you can see there was extraction of teeth as well.
Yeah.
Plus, his life was very difficult, and he keeps on. He says very clearly that my student, my child only doesn't behave with me properly. I feel very bad. I am not. My son doesn't listen to me, and this everything is due to. In short, one word I used to explain this. This is domestic relationship. In aphorism 5, I think if everyone well versed with it, there's a cause, a fundamental cause on aphorism 5. So on that basis, my prescription was Staphylococcus. And after staph, everyone saw that he was able to speak right away, and he's still better, and he's doing absolutely fantastic on staph. And this case is a very challenging case because he used to take a lot of homeopathic medicine, and ultimately he was better on staph. So that what I'm used to tell everyone, that you need to evaluate the patient in and out, that what patient demands and what has actually happened in his life, and how things have been affected with him, and what is actually making his pain come worse. And if you focus on trigemin rheulalgia in therapeutics, you use Rodley and use there are a lot of therapeutics. You follow that, you will be failed drastically, because I have done that and I am done and dusted. I know that it is not going to work. You do whatever, even if he in 5 days he'll feel much better, he'll come back again, run into your clinic and say I'm not better. So these all things have been done, experienced it well. And lastly, I would like to say that homeopathy is very, very helpful in cases of many neurological conditions, either be physical and psychological, but it always helps to know the underlying cause for the symptoms, like long term grief, shocks, emotional attacks. You need to see what actually went wrong with the patient, rather being more of report specific, or more of see, I'm not telling don't keep the knowledge of disease. You should have the knowledge of disease very well versed, but please understand that what patient is telling. Don't be more focused on that reports basic, rather than listen to the patient what he's telling. Then only your prescription will be correct, unprejudiced, not prejudiced. Because when we see reports, you get prejudiced ki, oh, maybe this condition is there, ye sepsis ho gaya, septicemia, ye blah blah, lot of things comes happening in the mind. Human nature, human tendency. But what, as a homeopathic physician, what you have to do, you have to listen to the patient. Keep everything aside and just listen what he demands, what he is saying well. This one-on-one person interaction is very much important, that what he wants, you should be very clear in perception and hearing and sound senses as per organ.
So, Dr. Jitesh, we have two questions. So, first question is, in your last case, injustice cannot support rubric you have taken, but he doesn't revolve. He doesn't revolt. That person doesn't revolt against anything. So
Yes.
he choose to be quiet. So,
Yes.
like, is that rubric appropriate for the case?
No, I didn't find anything, so I took injustice cannot support, because he says that he used to be quiet, but he cannot, he feels that something that has been happened with him. So I'm not more of repertory person, to be very honest. I'm more of what patient is saying. So injustice cannot support was taken the rubric, because he said that I cannot express my feelings. So injustice cannot support. Now people will ask, if you would have taken that causticum and staph, because causticum and staph is very, very closely associated with each other.
Yeah.
The strong uh, the strong point is, causticum will always retaliate, but staph will never retaliate. So he was staph because he used to suffer. He used to suffer, and he's still suffering only. Causticum will come out and he'll say that let's revolt.
Yeah.
So according to me and everyone who is listening this rubric is appropriate because he cannot support.
Yeah. And so there's one more question. What about the repetition in this case?
He's taking BD, and if the pain aggravates or pain comes more, he's taking on TDS. But right now he's in BD because the pain has been under control and he's not taking Previsca. He used to take a lot, 3 tablets a day. He's not taking anymore.
Okay.
So to conclude today's session, I'll tell what Dr. Boger has said. The similimum, the curative remedy, releases the reactive power strong enough to re-establish harmony, which in turn is capable of sweeping away almost any morbid condition. That is, any disease condition. So, lastly, I want to say that please be focused on what patient is saying, rather be on prejudiced of, theorizing or making rubrics, rather than just listen what he's saying.
Absolutely. So, yeah,
So
you
thank
can.
you everyone. If you have any queries, you can mail me.
You can take Dr. Jitesh email ID and you can mail directly to Dr. Jitesh, or this video will be uploaded on YouTube. You can like ask your questions on our YouTube channel as well. So thank you everyone for joining us today on this webinar. Thank you, Dr. Jitesh, for giving us such an insightful session. So thank you, Dr. Jitesh.
Thank you. Thank you.
So we'll take leave. Take care.
Thank
Bye-bye.
you. Thank you everyone. Thank you for joining us. And thank you so much.